What I wish I knew before starting cancer treatment. Following a cancer diagnosis, a patient is faced with a slew of life-altering decisions. It's difficult to know what to do in the first few weeks after receiving bad news, but there are several things you should do before beginning therapy. What to expect when getting cancer treatment. This is a compilation of questions and answers regarding what I wish I knew before starting cancer treatment. One of the most crucial things to understand before beginning cancer treatment is that you will be exposed to a large number of people. You'll see your physicians, nurses, and even family members. But it can be difficult to keep track of everyone. They're all there for different reasons. As a result, it's critical to have a plan in place before going in to ensure you get the assistance you require. You should be prepared for what to expect when you arrive to a cancer treatment facility. This may appear to be a minor detail, but it will be quite beneficial. Some of the items that should be included are as follows. A list of everyone's contact information at your treatment facility. If you have any particular questions regarding how your treatment will function, please ask them. Managing cancer treatment side effects. What are the risks of cancer treatment? Cancer therapy can be quite physically and emotionally taxing. It can induce fatigue, nausea, mood changes, weight loss, hair loss, constipation, diarrhea, and other digestive problems. Alopecia, or the loss of most or all of one's hair, is another typical side effect of cancer treatment. What you should know before getting a diagnosis and treatment. This is a compilation of questions and answers regarding what I wish I knew before starting cancer treatment. What kind of chemotherapy medications should I expect? When they first begin treatment, an estimated 72% of patients will only require one type of chemotherapy medicine. There are more than 75 distinct types of chemotherapies that can be employed, but most people only need to be aware of the one or two most likely to be utilized. This is because they will almost certainly be prescribed an immunotherapy medicine at some stage. How much longer till my next appointment? Most doctors will advise their patients how long they should expect to remain in therapy until their next appointment. They may advise the patient to keep a strict visit schedule, especially if the patient has a specified goal, such as finishing a marathon or graduating from college. Patients should not take appointments lightly and should keep to their schedule unless instructed otherwise by their doctor. How to maximize the benefits of your cancer treatment. Cancer treatment's negative effects can be difficult to deal with. The treatment might be so harsh at times that it can feel like it's not worth it. When faced with these difficult options, it can be difficult to know what to do and how to proceed with your treatment. I wish I'd known that the post-treatment exhaustion, sadness, and other adverse effects would fade as my body adjusted to the new regimen. I wish I'd known that some patients find relief in knowing they're getting rid of a lot of toxins, and that they may feel better if they supplement their diet with antioxidants or magnesium. Conclusion. It can be tough to know what to anticipate when you come in for treatment if you have been diagnosed with cancer. It is critical to understand what to expect before beginning therapy so that you are prepared for what is to come. I discovered that it was the questions I failed to ask that caused me the most concern. I was told I would need to be on some form of chemo because my cancer would be with me the rest of my life. At that moment in time, I didn't really get the full picture, and it required that I ask it again in order to fully understand. So, don't forget to ask the questions again if needed so that you will not be surprised when a time comes that feels different than you anticipated.